Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMFS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. Welcome to another episode. Today I am with multiple doctors, Dr. Benjamin Palla, Sebastian Graca, and Stephen Licht. Thank you guys for joining us on the podcast again. Really good to be with you guys.
Thanks for having us, Grant.
Great to be back.
Yeah, great to be back, Grant.
Yes, we did a podcast. Gosh, it's been a year or two now, but kind of about being a chief resident and, succeeding in residency, that type of stuff. And we got a lot of great feedback on that one. Today, we're hoping to do kind of a discussion with you guys on oral board prep. You guys all recently took the oral boards and passed them and received high honors. I didn't even know that was a thing, but you told me that you did receive those honors, and I'm sure you did, even though it's probably made up. But so glad to be with you guys. Yes, and I think this is a good topic. We have talked about oral board prep with others in the past, but each year I think it's evolving, and it's always good to hear about kind of the current situation of the oral board. So Ben, do you want to maybe start us off a little bit on your thoughts on prep and that type of stuff?
Yeah, thank you, Grant, especially for those unprovoked, very kind words. I know we make Dr. Millara proud each day that we walk in this world as oral surgeons, but yeah, so I think a part of it was just that we finished it and it was to use this as almost like a brain dump. Steve, Seb, and I studied together for this, and then it's starting to get to that point for the current chief residents. Now we're like in April where they can start considering like either how they want to approach studying for boards next year, or especially like the courses. So I think we wanted to talk a little bit about that. But maybe the first part is just talking a little bit about the oral comprehensive exam. So there's kind of almost like two parts to this, and they changed it recently where there is a fast track option so that the current chief residents can take the initial written portion in order to qualify for the OCE, the oral comprehensive exam. And the OCE is that's what I think when most people say boards exam, they're referring to that. It's in February, but you register as early as September is when it comes out. You register then, however you receive the dates for the test in December. And there's basically 3 sections. So maybe we could start getting into kind of a little bit more detail about maybe Seb and Steve could go even about their experience for that day and what it's like when you break it up into those 3 sections.
Sounds good. Do you want to do that, Sebastian?
Yeah. So there's 3 sections to the OCE exam. Section 1 is orthognathics infection, TMJ, and then section 2 is trauma implants reconstruction, and then section 3 is the medicine anesthesia, and then the fast topics, which could range from anywhere from RUNJ, ORN, cosmetics, cleft, pre-prosthetic surgery, gingival grafting, things like that. So I think looking at the exam as a whole, it really covers the full spectrum of oral maxillofacial surgery, and it really kind of tests you to make sure you have knowledge kind of each and every of those bases. Now, obviously, there's like cleft craniofacial, which are fellowship, track, didactics and residencies that people undergo, but you still kind of need talking and basic knowledge on those topics as to be kind of like a complete oral maxillofacial surgeon.
Okay. And real quick, Steve, what type of cost are we looking at? How much does it cost to take the boards, the travel, all that type of stuff?
Yeah. I think so. It's just a global overview of what we're talking about. I know a lot of your listeners, I think, are people interested in oral surgery, right? Like dental students even. Is that right?
Yeah.
Yeah. So just to kind of provide a big picture and to answer your question, we are 1 year out of residency, all of us, Ben, Seba, and I, or me. And we just took the oral board, which is part of the comprehensive ABOMS, board certification. And so the total cost includes the written exam, which now is part of the fast track we took as chief residents, and then the oral board we just took in February, like Ben said. So the total cost is about $3,300, I would say. That includes the written test, that includes the oral exam, and then of course you're looking at lodging for the oral exam. But there's discounted rates through A-bombs when you take that. And then I would say the only thing not included in that is board review courses, which also have their own cost, but I think we'll cover that later.
And the test itself is in Dallas. Is that still there?
It used to be,
Raleigh.
but now it's, yeah, you have to go all the way to Raleigh, North Carolina, which for somebody on the West Coast is just like a nice way to introduce you to the weekend and the exam,
Yeah.
the time switch and everything. But it is nice. So for the exam, basically, yeah, it's in Raleigh. Every single person takes it that 1 week in February. So everyone's like flying in there. And I think Steve, Seba, and I all had the same thing, even if I was on Tuesday, but I flew in on Sunday. I think I don't know, Steve, were you Wednesday, Steve?
Wednesday, and I got in kind of early. I got in on Sunday.
Okay.
I
And
flew in Monday and left right after my exam Tuesday night.
yeah, but definitely I think there's a big benefit of flying in early, and especially if you're moving kind of across country and switching up time zones. Get there. It's a nice Marriott. It's cheap. It wasn't that expensive, maybe like 150 a night, and then you can work out. They have a lovely mall across the
Lovely,
street.
lovely PF Chang's right across the street.
Nice.
And it's
Cheesecake Factory.
Factory.
Steve frequented the Cheesecake Factory multiple times during the week, it should be said. I don't know if he had a favorite cake that he sampled that time, but it's not bad. And every single person in the hotel is basically somebody who's taking the boards exams, and it's a little bit. I think it's nice. You see old friends, and then everyone's kind of in the same situation. You're just like, you've been studying at that point. This is compared to all the exams that studying for the DAT, maybe studying for like dental boards, studying for the the oral surgery. What was that? The CS. Somebody help me with this.
CBS.
Whatever.
CBSE.
CBSE. Yeah. I definitely, and I even asked my wife, what do you think I spent the most time studying? And I think we both agreed that the overall time and then kind of the amount of dedication and energy and money you put into something, I think the boards exam is by far the most comprehensive and kind of consuming.
I would agree.
But I thought too, though, on the same hand, you've had so many tests by this point. This is kind of the final one for most of us and they've kind of prepped you in residency, all the presentations you've given and the crap, you've had to be grilled on. I felt pretty prepared. I mean, you do have to review some of the minutia, but I think maybe a lot of us over prepare trying to memorize all these crazy details about stuff.
That could be true, but like you mentioned yourself, Grant, we're trying to achieve high merits and high honors. So, we want to do UIC
Good point.
proud when we all get there. But no, I think the people who, it'd be interesting. Maybe we could talk about the pass rate then, because I would imagine that it's almost like some people go into this with maybe a correct mindset and, they dedicate enough time. And I think the pass rate this year was like 77%. In the past, it's been anywhere from I think as low as like 60 to, I think there's a year it bumped up towards like 90. But I would imagine that some people, I think, walk into the exam and they kind of have, they haven't really prepared in a way that, in order to articulate, all that knowledge you have during residency or mentioning, it's almost like developing a new skill. You do have the knowledge, you've seen all this stuff, especially, we're lucky coming from UIC, but in order to, if somebody asks you just like blank, what is diabetes, unless you've like maybe practiced that or, all of us obviously as, oral surgery graduates know what it is, but to articulate it in a sentence so that you don't, you don't waste part of your 12 minutes for that little topic or section, then it can be very difficult. So it definitely takes practice. And I think maybe that's the next thing to emphasize, just as almost like how to prepare for the exam, because it isn't necessarily like the DAT where you just open up a book. You need to study with a group.
I totally agree. Maybe Sebastian, you could talk to us a little bit about that. What were some of the main study materials you used, and how did you prep from a knowledge standpoint?
So there's a couple great books out there. Dr. Reddy's got Oral Board Review book. I think he's coming out with a new edition this summer. I think that you mentioned that on your podcast before.
Yeah.
There's also the oral max face surgery review by Lam and Laskin. That's like that green book. That's a pretty good resource. You know, it really outlines things very well. And then you also have the basics from oral surgery, the Petersons and Atlas by Katamani. You have the white papers that Amos releases all the time on raunch, anesthesia, dysplasia. So I would definitely review those because that's kind of Amos's guidelines, and that kind of really helps dictate how to practice, safely. And then you have also the white papers on anesthesia NPO guidelines. On top of that, there's a lot of research that recently came out, like on YouTube. There's Oral Surgery Fight Club. So I think that's just recordings of people doing their study groups and just kind of reviewing cases and seeing how they do it. You can make flashcards, and then obviously your podcast is fantastic for this with Dr. Genzer. You guys have the didactic courses. So I think just listening to those in your car while you drive, you kind of have this dead space every day, and just kind of filling it in with knowledge really helps you study a lot more for these oral boards. And then I think by far the most important is creating a study group. So that's what Ben, myself, and Steve did. And I think we would meet every Wednesday. We would run through like 4 to 5 cases. And I think just that alone, getting the reps in, really kind of helps simulate the test day. And I can't stress enough that you have to be kind of prepared for this exam, because once the pressure hits, you kind of want to go on autopilot and you just want to spit out answers. And if you don't have that kind of reflex, that day is going to be very stressful.
Good call. Steven, anything to add to the prep and studying and practicing as a group?
Only thing I would add to that would be the emphasis on the group study. We would meet once a week and do cases. I think that should be the focal point of your preparation. And then for me personally, I used all the resources that Sebastian just mentioned, but I wanted something centralized where I could reference, if I researched something on Saturday in August, and then I had to look it back up in November, I didn't want to have to look through 3 books again. So I made my own outline for everything. I had my own personal study time, and that is what I use even still when I'm in the office or something. If I have a question about a dosage or a follow-up regimen or something, I have that now that I can use as a resource.
That's fantastic.
Yeah, there's so many numbers out there. Like as you start getting into like I don't know if one of them maybe like either lidocaine toxicity or like your diagnosis for diabetes, your cutoffs for hypertension, or yeah, like Steve said, you want to have the same reference. You don't want to like go Google it or okay, and the Ready Blue Book, which is kind of like the Bible for I think most people studying for this. Like maybe they say one thing, but online it says another, and oh, actually that was updated, or some of that information is correct or incorrect. You just want to always go back to the same thing, and almost like that repetition is especially like if you could associate it. I did what Steve did as well. I like made my own study guide, and if you can associate it with like I always put images nearby to help kind of like log that memory and everything. It's a lot of information. Like except you're talking 4 to 6 years of residency. You're trying to almost go back and relearn to almost a new extent and like almost in a new depth. It's very difficult to maintain all of that knowledge over the 6 to 7 months you're studying for this exam and being able to articulate it.
Yeah, that's a really good point. Okay, so how about courses that you could potentially take? Because I know we've had multiple people on the podcast too, advertiser courses. I know Ben Heckler does a course. What did you guys do any of those, and what was the most helpful? Maybe we'll start with Steve.
Yeah, I did the St. Louis course. One of the partners at the practice where I'm working had done it, and so he recommended it. It's in St. Louis with Genzer and Reddy and all those guys, and I found it to be very helpful. I really enjoyed it. Having Dr. Genzer as a resource was nice. We did extra review with him later in the I would say close to the winter as well. So those guys were awesome. So I like that course.
And that, do you know the cost on that one?
We made a little spreadsheet here for review. I guess it's around. I wouldn't want to be, maybe Ben, if you would be quoted on this. It looks like it's about, I guess, 2,500.
Yeah, I mean, I wrote the numbers down, so I mean, I don't really, I Googled it, I think, but I think it's 2,500 plus hotel, and it's 3 days. The other courses, so there's St. Louis, Nashville, Denver, Jacksonville. The Nashville course, I think, is also around $2,500, but you have to pay for a hotel. It's 3 days.
Okay.
And Seba, you did
I
St.
did
Louis
the
too,
St.
or,
Louis, just the St. Louis course.
and what city is that located in?
St. Louis. I already said that.
And then I didn't do a study course, and this is kind of like, why maybe you talk about people plugging the program, but I wanted to almost like plug, we want to start a new course or like a new option or location one in Los Angeles. One, because there's none on the West Coast. So I know that, some of the residents out here have been talking about that, but the other one was just like as you're graduating and you start just dumping money into like, oh, your license of the, whatever new state you're moving to, you have to pay for moving, rent. I just felt like everything was piling up, and then to have like another on top of the $3,300 you're spending to take this oral comprehensive exam, to do another 2,500 for a review course. I didn't do a review course last year. I think I benefited by being in a study group with like Steve and Seba, who obviously that kind of jump started their study. Perspective and stuff. But this next year in September, so I wanted to do one kind of early. It's going to be September 6th. We're doing a Los Angeles board review course, and Dr. Milaro is going to come out. It's in Santa Monica. And then the cost will only be, if you come with somebody, it'll be $750. So we're trying to make it more reasonable, and it's just going to be on a Saturday. That way you don't have to kind of interrupt your whole week as you like enter this new practice and show up day one and say, hey, I need to take a week off to go to this review course. So I'm just trying to, start everyone early, encourage everyone to like come with a partner, study together. Because at the end of the day, I think that the main thing that really matters isn't necessarily the review course. It's like getting in a group with people and starting to review things each week and slowly build up towards February. So that's the plug. If anyone has more info or wants more information, they could email me or call me, or I'll give Dr. Stucki all my information.
Okay. Yeah, we'll put your email in the show notes. And when you say that the next year, are you saying this is starting in 2025 or 2026?
Yeah. No, this upcoming September. So I've sent out a few emails to some of the West Coast programs. So we've had a few respondents, which is nice. Just hoping to get a few more. And then, the other benefit is like, maybe even today's a good example of this is like when it's 7 a.m. Either Mountain Time, or if it's, Steve's over on the East Coast. So if when we were studying together, sometimes the hours were a little bit crazy and chaotic. If you can be in the same time zone, it makes it a little bit easier for like the rest of us on the West Coast. We don't have to get up as early. This is the earliest I've got up since residency. So
nice. Okay, so that's awesome to have that opportunity there in the West in Los Angeles.
September 6th, just email me. bpalla12@gmail.com. You can just email me.
Awesome. Fantastic. I would mention too, I took my board, over 10 years ago, but at that point, there was also a lot of good audio recordings of prior, boards and things. So I got my hands on, Denver and Lewis and others, and I was just listening to those in my car. So, even if you don't have the resources to go somewhere, I'm sure you could reach out and find some audio that's been recorded. All right. How about study tips? Sebastian, you want to talk to us a little bit about that?
Yeah, so the biggest tip I probably have is to start early. So I think Steve and we started around early August, and been kind of doing this, I think, in October. All we did was just meet a few times and kind of just run through easy cases, but it kind of jumpstarted our brain to kind of start thinking in that board mentality.
Yeah.
Another big tip would be that group study. Weekly, pick a topic, make a calendar, and make sure you kind of hit each topic every week. So if one week you do dental alveolar, you'll do implants, reconstruction, pathology. And then towards the end, you'll kind of jumble them around. But at least in the first, couple of months, you want to make sure you hit each big topic, and don't shy away from like cleft and the pathology just because you're not familiar with it. You got to still kind of make sure you're hitting all those big topics because they will pop up on the boards. And then
Okay.
other big resources is reach out to your program, set up mock boards, with maybe prior residents or attendings. They're a very good resource. They've taken the boards, so they could kind of help guide you on that path to, properly answering the questions, not wasting time with your responses and stuff like that. And the big kind of thing is you want to be super broad when you answer with boards. You don't want to be, fumbling around words, just throwing around buzzwords just to have like the examiners think that you know what you're talking about. You want to say like this is X disease characterized by X. You want to be crystal clear, 2 seconds, so that they could ask you the question and you just move on to the next thing.
Got it. Steve, what else do you have to add to study tips?
Just that in our group, we did not actually do any reviewing of material together. I felt pretty strongly about that. I didn't really want to spend any time with, outside of my personal study time where I'm actually like we weren't like reviewing textbooks together. Every time we met, we were doing mock cases. And of course, if we had questions, we would talk about the material, but we didn't actually like study together. Some people do that. And if you do, that's great, but we didn't. And then the only other thing I'd add, an element of board review courses in general is when they are. And then another thing that I heard during all the studying was sort of like a hot topic would be how many review courses should you take? I only felt it was necessary to take one, but a big factor of that was cost. If they were more affordable, I may have considered more than one, and then in time. So I think that's why what Ben's starting is really nice because it'll be a weekend, you don't have to miss work, and it's very cost effective. So and it's early, and that's the last factor is when is it? It's early, right? So it's in September. You have time afterwards to work with the people you've met. Whereas other courses like Nashville, which I've heard great things about, is like kind of close to the exam time. So that one, it's just a little different where that one would be better for, I think, like polishing up your, towards the end type of thing.
And I'm trying to in September, the same, I polished up almost like this big text that I had been studying with or using this study guide, throughout those 6 months with like different images attached. It's like 150 pages, but for everyone who attends the Los Angeles course, I'm going to try to make that almost kind of the reference guide so that when you're looking back, well, what are your cutoffs for class 1, class 2 hypertension or hypertensive urgency, emergency, like, where it's the same thing every time it's in the book and everyone's referencing the same thing, from the start. And, the other benefit that, some other, these courses don't necessarily do. I know Dr. Genzer does like something later on in the year over the course of a weekend, but if you come to like the Los Angeles course, we're going to have it where, everyone in that group, we all get together and stay in contact and start doing weekly study sessions. Like we can host and we can guide. You also meet people so that, it's the best thing you can possibly do isn't necessarily the study course. It's great. We'll provide this study material. But you want to get in a group, start, almost practicing. Like I said, it's like developing a new skill to be able to articulate something in one sentence and display to the examiner. Like they just want to know that you know this stuff. Once they pick up that, okay, this guy could talk to me, for 20 minutes about diabetes, but he at least said, it's an endocrine disorder characterized by hyperglycemia. Like they'll be done and they'll move on. They're not going to start pimping you about other stuff. So you just want to, it takes a long time to develop that skill. And I think most people don't until somebody has you articulate it to them, for the first time. I think then you realize that like, oh shit, this is actually going to be kind of difficult. It takes a while, and that's why just talking with each other. I agree with what Steve said. Don't necessarily waste time going through material. You just want to jump into it the 1 hour you're dedicating to this a week and get right to it and take it serious and kind of maximize the potential or efficiency of that hour.
Well, yeah, I agree with that as well. Okay, how about we'll kind of end on, and maybe we should start with this, but why go through all the trouble of being board certified? What are some of the benefits? Maybe Ben, you could kick us off on that.
Oh, I just, I credit Dr. Silla. I think there's like a few articles I read in JOMS recently. Since boards, it's actually I've had like almost like a brain fog about being able to like read anything like oral surgery related. Like you'll just I don't know, but I was able to at least pick up. I think in March there was one in March about how Chat GPT passed like the Israeli OMS boards exam, which I just thought was like a unique comment. And then as far as like the reasons why, so Dr. Stilla just wrote this article in JOMS, and I guess part of this is, what he's trying to say is that, not everyone is pursuing this. A lot of people graduate, oral surgery residency, and I think their thought is, well, okay, well, why am I going to spend, $2,000 or whatever it is on the written exam, another 3,000 on the oral exam, then travel all the way to Raleigh, kind of, it is a huge sacrifice over 6 months, of your personal time, your professional life, to study for this exam. So like, why even go through it? For most of the graduates right now, I think a lot of people are going into, these private equity groups. I do think it's actually beneficial of the USOSM, kind of a larger group, they require it, for any of their partners, which I think is probably good that they're encouraging it. But, the other thing is just, I think especially as kind of specialist providers and providers of anesthesia, to be board certified is maybe in some ways like a protection, but it's also demonstrating to, patients who come in, that you have not only just like graduated residency, but exceeded or like, met almost like higher standards of your field, and by the board. And then something else that Dr. Silla mentioned is even just if you're board certified, your malpractice payments, or I guess it doesn't affect your malpractice payments, but those who lack board certification have a higher rate of medical malpractice. So maybe those who don't study for boards, like I think Steven Seb and I would all say the same thing. I learned more in basically in the 6 months like studying for boards. I feel like I almost like relearned all of oral surgery. Like when I think back about my knowledge right now, so much of it came from doing deep dives over the last 6 months, either into Peterson's or different studies, like why do we say, for if you want to place an osteotome on the lateral piriform band, how far back can it go? And like going into those studies and seeing how they were performed and, the amount of knowledge that you gain just from studying alone, I think would be a benefit because you're going to, use this information every day. And I know that just about every day when I'm doing a consult, I think back and reference something that I learned basically just studying for boards. So it's extremely helpful.
Yeah, I completely agree. Anything to add to that, Sebastian?
Yeah, I just think I mostly did it for kind of my own personal self. Like I couldn't imagine not taking oral boards and not having that that recognition of the highest standard of care, and specialization within the kind of specialty. I mean, we spent so many years in residency, and it's just that one last check mark to just mark off. And for me, I was gonna take it to the next step. I've gone through this entire journey, dental school, oral surgery. I couldn't imagine just dropping off right there and not taking oral boards. So to me, it was kind of like a no-brainer. I was going to take it, 100%.
Is the next step you're pursuing a fellowship in head and neck microvascular surgery?
Steve, what about you? Any other comments on that?
Just that I don't know who said it along the way, but I heard this somewhere, you're not really finished with residency until you take the oral board. I did find that to be true, from both a stress and achievement and knowledge level. One simple thing I think Ben sort of touched on at the end, when you're studying, when you're reading all this stuff and you're like, man, this is a lot, you're working really hard even after you finished or graduated residency. The takeaway I would say is it really did help me like be a better doctor, to look all this stuff up whenever things come in as a consult, and it's something that's is a little bit more uncommon or whatever. It's like, well, I just researched all this stuff. Like I do know what to do. I do think that if you weren't studying or didn't take this, you may forget a lot of the stuff that you spent all that time working hard learning. And so it's worthwhile just for that.
Yeah.
That's about it.
I agree as well.
And they're starting to grade the boards this year, Dr. Stucki.
Oh, really?
I think this is the first year everyone received a score.
Huh.
So like a numeric score. I'm guessing from like 0 to 100.
Okay.
I think they've done that last year or 2 years ago as well, from what I've heard.
Oh,
But they
I try to ask around and I didn't.
historically they did not do that, from what I understand.
Interesting. Okay. One more point to add about why to become board certified is just a lot of insurance companies have a higher reimbursement rate if you are board certified. Like I had to give them all my board certification info, and so just another point there that can be helpful. But
That's a great question.
I feel the same way as you guys that the studying I felt was super helpful for me. I learn much better when it's more application to real life cases and patients and things, and it was just a real boost to my knowledge to go over that.
When
Excellent.
does Jacob graduate? You're gonna help him study when the time comes?
Oh yes, for sure. I'll grill him. I'll hook him up with you guys in your course. But yeah, he's finished this summer.
Oh, really? Oh, nice.
Yeah. So it's great. Well, good. Anyone who's listening to this, and I'll put all of your guys' emails in the show notes. If you're good with that, you can reach out to Ben, Sebastian, or Steve, or myself. But I appreciate you guys running through this. That's really nice of you. Real quick to end the podcast, you guys, what's the best book you guys have read recently, or are you done reading books after oral boards? You're just like, I can't take it anymore.
Start. I've been listening to your podcast.
Oh, nice.
Yeah, recently I listened to the one with the Levine group, and
Yeah.
you guys mentioned the how to. I'm just drawing a blank. How to talk and understand people, right? What is it by
Yes.
Dale Carnegie? Yeah. So
Uh-huh.
I once I listened to that, I got that, and that's my most recent read. How to Win and Influence People. That's it.
How to Win Friends and Influence People is such a great book. It's a classic. Sebastian, are you reading anything, or do you
Yeah,
just?
so
But
I've recently, I haven't had time in residency to ever catch up on finances. So I'm now reading the book, The Single Best Investment, which is by Lowell Miller. It's just a book on creating wealth with dividend growth. So it's about dividend stocks and why you should invest in them and kind of the pros and cons of them.
The stock market's going really well right now. Maybe we
Yeah.
could spend a little. We should do another episode where we just talk about politics.
Yeah, they'll be so happy.
We'll spice it up a little bit.
Ben's smiling as he says the stock market's going down. He got a big grin on.
Yeah, but that's where you get rid of the bear markets, guys. So
I'm just ready. I'm getting ready to buy. If it drops another 10%, I could probably afford something. So, these are exciting times.
any good books for you, Ben?
Definitely not anything oral surgery related. I'm like I just hop in and out of like a bunch of different books. I'm reading one. I mean, none of these are going to be exciting for, I think, reviewers, but Isabella Stewart Gardner, she had like a museum in Boston that was near a dental school. So there's a book that came out about her. I'm reading, and then
Nice.
we're preparing to go to Paris. So I decided that The Hunchback of Notre Dame would be like a good preparation for, understanding the French people and culture before I get there. I'm definitely going to bring up Victor Hugo with people at the bar. And then what else was I just started? Oh, there's one of the lady who works for the Mark Zuckerberg, the Facebook one, John, my partner, and he also graduated from USC. He recommended this book, and I've only been through the first few chapters, but she got attacked by a shark, and then somehow she's working for Mark Zuckerberg now, so I just have to get into it. But from my understanding, he didn't want it highly publicized, which only enticed me more to purchase it from Amazon and start reading it.
Nice. Okay. Good rec. Excellent.
Are you reading any books, Grant? Do you ever talk about, or you just you want to talk about politics and who you voted for last year?
No, I try to avoid that. I just do neutral questions. I commute. I usually have like a 30 to 40 minute commute each way every day. So I read a lot of books. I go through a ton of audio. But I don't know if you guys
What about a book to prepare for as people graduate residency and they're looking at having children? Is there a favorite book about preparing you for parenthood?
Oh my, I've read a lot of books on parenting. There's one that was called, it's a good one. It's a little more obscure. It's called Real Love in Parenting, and it's about it's more for like once your kids, are getting into, I don't know, elementary school, middle school, and how to train them, teach them with love, as opposed to like, if you do this or that, you're gonna get all these punishments, and that type of a thing. But But I will just say it's very difficult to motivate your kids purely with love. I've tried it. And in the end, I just end up slapping them in the face or giving them a good hard spank, and it's just not working. No, I'm just kidding. I don't do any of that stuff. But no, that's a good book. There's one I mentioned in the past called The Way of the Superior Man, which is a fantastic book for men who want to have a strong relationship and know how to help their women.
Ben should read that one, I think.
Yeah, if you're having any women troubles in your life, or your wife's mad at you, I would read that book because that will guide you back to the North Star. Anyhow, I'm sure we all have those problems.
What about sleep training? Were you strict with sleep training? Did you get them? What would you do for that, or you let them kind of do their own schedule? I'm asking you because I feel like you probably have definitely more kids than us three, but I feel like you may be an expert in this topic.
Kids and sleep. Yeah, I mean, me and my wife vary on our opinions on this one. My opinion is you stick them in their room, you lock the door, they cry, and they realize they can't get out, and they just go back to sleep. My wife thinks every time they cry, you need to attend to their,
That's probably a
weakness.
pretty common problem. I would say that's probably pretty common.
Yeah, yes.
So were your kids attended to, or locked in a dark room?
No, my wife's a deep sleeper, so she can't hear them. So pretty much, I just lock the door, and they grew harder and stronger over time.
Are there like scratches? There's scratches on the inside of like all of your children's door.
Oh yes, for sure. Punch marks, scratch.
They're trying to like gnaw their way underneath the door frame or something.
Yeah. No, I've missed this in the past, but I'm the opposite of a helicopter parent. My kids are just have to learn things on their own. We don't clean their rooms for them. We don't do their laundry. They have to do all their
Oh,
stuff.
jeez.
We don't make their lunches. That just fosters weak kids. And in the end, how they become an oral surgeon? Not like that. Okay.
You should have to be able to survive like a few days in the wilderness. Just
Exactly.
I have questions about Dr. Stucki's childhood, his own personal childhood, that maybe we'll bring up at a later time, because I think he's in a burst an aneurysm right now.
No, yeah, my parents are the same way, and that's how I dealt with Dr. Maloro when I got there. I was like, I'm preparing for this, and
I've been prepared for this man my whole life.
one more book I was going to bring up that's fantastic is Shoe Dog by Phil Knight. He's the founder of Nike. I just reread that one, but that one, like Steve Jobs' book, I love reading these like kind of biographies of these guys who created these companies out of nothing. But it's so exciting, man, to read books like that. It always inspires me.
Nice.
All right. Well, thank you guys. I appreciate your time. Let's reconnect sometime. Always be thinking of topics and stuff we can go over in the podcast, because we always need new material.
No, thanks for having us. Very appreciative, Grant.
Thanks, Grant. Always
thanks,
a pleasure.
Grant.
No problem. Thank you guys. We'll talk to you later. Have a good one.
All right.
See ya.
Take care. Bye.
Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.